I loved about mental health, and I think it's true of all of the mental health professions and a lot of the caring professions, is that your personality, your relationship with people is part of your therapeutic kind of armoury. Your relationship is what often helps you to help people. I was very lucky to have a mum and dad who wanted the best for their children. I was the oldest of 4 boys at home. They led us to believe that we can do anything, and I'm very grateful to them for that. It was a tremendous thing to give your children. Not dissimilar to what the 2 universities I work for give their students. I went to the local grammar school. A really big influence was my biology teacher, a man called Brian Reeves, who's absolutely fantastic. And I was very lazy, sixth former. I didn't study, and one day he got hugely angry with me and said that I had potential and that if I didn't work, I wouldn't realise it. So I worked. So I went to Guy's Hospital Medical School and came out of the sleepy seaside town of Hastings and came to London. Very early on, I realised I wanted to do psychiatry, and I went on to become a senior lecturer at St George's, and that was in around about 1994. So I started at St George's in about 91 as a research fellow. Along the way, I, like many of us, discovered a love for teaching, initially working as a module lead, then becoming course director for medicine, which was a very big job. And during that time I was very involved with new developments like St George's flagship graduate entry programme in medicine. It was very interesting to develop a new medical degree that took in arts graduates as well as science graduates, which essentially recognised that talented people from other walks of life can be fantastic nurses, midwives and allied health professionals. So I moved on to become course director for medicine. That led me on to then apply to be the Dean for Education at St George's. I was increasingly interested in the work that was being done in the joint faculty with Kingston University. And the joint faculty was designed to get the best of both universities for its students and its staff and its researchers. The joint faculty has a very proud and very prolific research record, and we've got some real research stars in our midst. The 2 universities that I've been very proud to work for during my career have very similar visions and missions, and that's really to change the lives of their students and to contribute to society through research that's relevant to people. In terms of my time as Dean of the Joint Faculty, one of my jobs was to align the programmes by their location within the 2 universities. So we took on the ambitious task of relocating radiography to St George's. Other things that were important were the relocation of midwifery, a fantastic team down to Kingston Hill, and the development of the nursing and midwifery skills lab, clinical skills centre. Occupational therapy is a programme that colleagues developed at St George's, which I was very proud to be associated with. It's very exciting indeed to be working with a team that are developing a new educational programme. And of course I couldn't not mention the Nursing Associate Programme, which when it was set up, I think, if I can say quite frankly, was also the best in the country. It's an outstanding programme. And of course the big thing was leading the faculty through 2 years of the COVID pandemic. And there we found ourselves very much on the front line, because we were responsible for teacher education, social work education, nursing and midwifery education, and allied health professions education. And I'm enormously proud of colleagues on the front line of educational delivery. People work very hard to work safely with students on campus and in practice to deliver the best education for them. Also, if I can be frank, with the kind of almost unspoken agenda of helping people to get into practice on time in order to support the workforce at the front line, in schools, in social care settings and in hospitals and the community. One of the proud moments for me was going to the House of Lords to celebrate the anniversary of learning disability nursing, and an old colleague and friend, Baroness Sheena Hollins, hosted us that day, and students and staff and service users attended that event. We've won lots of awards in the faculty, and very recently, for example, we had the local trust responsible for learning disability care, naming one of our students Nursing Student of the Year. There are too many actually Students of the Year to mention, and nursing teams and our health profession teams have won awards. For me, graduation was always an important time to invite colleagues who wanted to come and see the output of all of their hard work over the previous year. All of us are doing something incredibly worthwhile, which is to deliver opportunity and bright futures to the students that we have the privilege of working with.